Hospital bill in the US versus France. You need an emergency appendectomy. In the United States, the bill averages $13,003. In France, the same procedure costs $4,463. Same surgery. Same outcome. 3 times the price. Here's why American hospital bills are bankrupting families, while French citizens barely see a bill at all. In this video, you'll learn the real cost breakdown of hospital procedures in both countries, why administrative costs alone add 25% to US hospital bills, the shocking difference between what you're charged versus what insurance actually pays, and why a routine doctor's visit costs $95 in the US, but only $30 in France. The United States spends an average $6,402 per person annually on medical care. France spends about half that while providing better maternity benefits and complete coverage for people with conditions such as diabetes and cancer. Health expenditures per person in the U.S. were $13,432 in 2023, which was over $3,700 more than any other high-income nation. Americans aren't sicker. They're not using more healthcare. They're just paying wildly inflated prices. Let's break down a real example. A hospital stay costs an average of $1,825 in Spain, $5,004 in Germany, and an average of $15,734 in the US. A single day in a hospital in the US costs, on average, $1,514, up to as much as $12,537, while in France, it costs $853. Same bed, same nurses. Nearly double the cost. Why? Administrative bloat, profit margins, and zero price regulation. An appendectomy ranges from an average of $1,030 in Argentina to $5,500 in Chile to an average of $13,003 in the US. Data from the Federal Agency of Healthcare Research and Quality and the International Federation of Health Plans suggest the nationwide average price for an appendectomy is almost $28,000. But wait, it gets worse. A study of 19,368 patients found appendectomy costs ranged from $1,500 to $180,000. Same procedure. Same country. A 120-fold price difference depending on which hospital you stumble into during your emergency. Now let's talk about what you're actually paying for. Administrative costs accounted for 25.3% of total U.S. hospital expenditures. Next highest were the Netherlands at 19.8% and England at 15.5%. Scotland and Canada, whose single-payer systems pay hospitals global operating budgets, had the lowest administrative costs. Administrative costs are capped at 5.5% in France. By contrast, administrative costs can be up to 20% of a bill in the United States. 1/4 of every dollar you pay goes to billing, coding, insurance negotiations, debt collection, and profit extraction. Reducing U.S. per capita spending for hospital administration to Scottish or Canadian levels would have saved more than $150 billion. That's $150 billion wasted on paperwork, not healthcare. Let's compare specific procedures. Hip replacement surgery costs an average of $25,061 up to $87,987 in the US, but just $10,927 in France. Knee replacement surgery costs $35,000 in the United States, 21,000 euros in Germany, 18,500 pounds in the United Kingdom, while in France, it costs 14,000 euros. A coronary angioplasty with stent insertion costs $28,200 in the United States versus 9,000 euros in France. Median price for routine heart bypass surgery in the US is $46,547, up to $61,649. In France, the average cost is $22,844. Coronary artery bypass surgery costs $4,525 in India, but on average, $67,583 in the United States. 15 times more expensive. For the same surgery, same outcomes. Even routine visits are absurd. A routine doctor's visit in the US costs an average $95, up to as much as $176. In France, you'll pay just $30. A routine doctor's office visit costs just $9 in Argentina, $11 in Spain, $16 in India, $23 in France, $30 in Canada, $40 in Germany, $45 in Chile, $64 in Switzerland. America charges triple what wealthy European nations charge for a 15-minute appointment. Americans get less MRI scans per person than Japan and have fewer hip and knee replacements and cardiac catheterizations than many European countries. We have fewer hospital discharges at 131 per 1,000 people versus the OECD median of 160 and France's 263 per 1,000. The average hospital stay per person is also lower in the US. So what's driving the insane costs? Among prescription drug costs, we pay far more than any other country, at least 20% more than Canada and over 60% more than New Zealand. For the same MRI and CT scans, we also pay more. $1,080 is the commercial average cost for an MRI in the US as compared to $599 in Germany. A CT of the head costs $510 on average in the US versus $272 in Germany. Physicians' incomes are the highest. $187,000 on average among primary care doctors in the US versus $93,000 in Australia, and $442,000 among orthopedic surgeons in the US versus $154,000 in France. American doctors earn 3 times what French doctors earn, not because they're better trained, because the system allows it. But here's the critical difference. In France, the national insurance program is funded mostly by payroll and income taxes. Those payments go to several quasi-public insurance funds that then negotiate with medical unions to set doctors' fees. The government regulates most hospital fees. This system works collectively to keep costs down. When someone goes to see a doctor, the national insurance program pays 70% of the bill. Most of the other 30% gets picked up by supplemental private insurance, which almost everyone has. It's affordable and much of it gets paid for by a person's employer. There are no uninsured in France. In France, you show your carte vitale, a public insurance card, at a public hospital, and it's likely you won't pay a dime and you won't see a bill. The assurance maladie is debited from your salary. You pay more tax in France than in the US. That's how they make up the difference. French citizens pay higher income taxes, but they pay significantly less out-of-pocket for healthcare than Americans do, between insurance premiums, deductibles, copays, and surprise bills. In France, unlike in Britain and Canada, there are no waiting lists to get elective surgery or see a specialist. The myth that universal healthcare means long waits is propaganda. France has universal coverage, price controls, and faster access than the US. Mortality rates in US hospitals after admission for a heart attack are just average at 4.3% as compared to just 2.3% in Denmark. Overall, we have the highest rate of death that would be amenable to healthcare intervention. The US has 96 such deaths per 100,000 people as compared to France's 55 deaths. Americans pay more and die more. That's the brutal reality. In 2000, healthcare experts for the World Health Organization ranked the world's healthcare systems. They studied 191 countries. France ranked number 1 in terms of healthcare outcomes. The US ranked 37th behind virtually all European countries, as well as Morocco, Oman, and Costa Rica. The wealthiest nation on Earth ranks 37th in healthcare performance. One final note. This video is not financial advice. Always do your own research and consult with a professional for your specific situation. Here's what you need to know. If you're traveling internationally and need medical care, check what your insurance actually covers abroad. Ask hospitals for itemized bills before you agree to treatment. Negotiate aggressively. Hospitals have financial assistance programs they don't advertise. Some patients with non-emergency procedures may choose medical tourism in France, Spain, or Germany and save tens of thousands of dollars, even after flights and accommodation. Subscribe so you don't miss it. And if this opened your eyes to how broken the US healthcare system really is, hit the like button.